So we're doing a clinical trial today at Grand River Hospital. Grand River Hospital is here in Kitchener-Waterloo, and the trial is around lung cancer. So we have patients who have lung cancer who are clinically indicated to have their CT. We'll have the CT along with our single exposure dual energy X-ray. These patients, we have a trial up to about 30 patients. And right now we've recruited to date about 20 plus. We expect to compare between what we see in CT and to our current dual energy X-ray. The goal here is to really look for calcified nodules or potentially hidden lesions that are behind the rib cage. But number one is really to look at if a nodule is calcified or not calcified. That's something they actually do in CT as well. So for the first 10 images patients have been reviewed by the radiologist at the hospital. And he had a great comment on one patient where there were nodules that in the standard X-ray was hard to determine if they're calcified or not, but by looking at our images, he was able to determine that these were calcified nodules. If you look over here, we have a patient here. This is one of the side views, and this is where a great example of looking at the nodules where there's some nodules here in the middle. Hard to determine really if they're calcified or not. We look at the bone, the soft tissue. So our capability is to be able to subtract out the bones and look at only the soft tissue. Some of these nodules actually disappear, but they reappear right here in the bone image. So this is the bone image subtracting out the soft tissue. And now you can see the calcified nodule. So now you know with one exposure, very simple X-ray, that these are calcified nodules and don't need any follow-up.